My name is Samson Arigbamo, presenting my Fieldwork proposal on prevalence of healthcare-acquired infections in nursing homes. Healthcare-acquired infections are infections that develop in healthcare facilities after 48 hours of admission into such facilities. The infections may be bacterial or fungal infections and could be devastating to the patient population in these healthcare settings. The seriousness of healthcare-acquired infections in nursing homes was recognized earlier in the 1980s and consequently led to the development of infection control programs. Despite several studies on these infections, there are still no adequate studies establishing the efficacy of infection control programs in nursing homes and rehab centers. The Centers for Disease Control and Prevention estimate that 2 million patients suffer from healthcare acquired infections every year and nearly 100,000 of them die. This infection results in up to $4.5 billion in additional healthcare expenses annually. Prevalence of these infections is likely to increase as a result of increasing number of elderly residents requiring nursing home care as well as premature discharge of patients from acute care settings to such nursing homes. The elderly and the sick population are noted to have increased incidence and severity of these infections. This specific group of residents is susceptible to healthcare-acquired infections because of multiple medical problems, compromised immune system, use of multiple medications that may impair the body's resistance to different infections. All these factors, coupled with the fact that nursing homes are noted to have many reservoirs for infectious agents, increase the prevalence of these infections. During my fieldwork proposal, my focus will be to study the prevalence of these infections in the nursing home and rehab centers by using my facility, Future Care Lackern, as a fieldwork site. Analysis and assessment of current infection control practices of Future Care Lackern will be conducted, and recommendations will then be made for evidence-based approaches and best practices to reduce or prevent such infections. During the course of this fieldwork, a qualitative approach will be utilized to describe the phenomena of infection prevention, surveillance, and control in nursing homes. Comprehensive assessment of infection control processes associated with specific infections and organisms will also be conducted. My hope is that after thorough evaluation of the findings from this fieldwork, the utilization of the findings and recommendations will contribute to the effort to reduce prevalence of health care acquired infections in facilities throughout the country. The fieldwork, as earlier stated, will be conducted at Future Care Lackern, located in the city of Baltimore, in the state of Maryland. The facility is a 200-bed nursing and rehab center that provides comprehensive care to both short and long-term care patients. Plan of care of such patients are developed in the facility to help patients reach their health goals and to return home if possible. Otherwise, they will transition into long-term care. The facility also provides long-term care residency to patients that need such services. This fieldwork project will provide opportunities to evaluate the high prevalence of health care acquired infections as well as develop processes to reduce such infections. This can be achieved through utilization of evidence-based infection control practices. Findings from the study will also be adopted by similar facilities in the state of Maryland. Understanding the potential sources of infections in the healthcare facilities and adopting evidence-based practices through effective infection control processes is critical in order to significantly reduce prevalence of such infections. During the study, a group of cohorts with existing infectious diseases processes will be selected. Medical records of such patients will be reviewed. Data will be gathered. Lab results and diagnostic studies will be analyzed. Interviews will also be conducted with the medical director, the group of physicians, the nurse practitioners, the registered nurses, the nursing assistant, or other members of the interdisciplinary team. Methodology. As a director of nursing in the facility, equipped with the understanding that infections such as urinary tract infection, pneumonia, upper respiratory tract infection, and soft tissue infections are ranked as the most challenging and the most common infections in rehab and nursing homes, our codes significantly influence the adherence and enforcement of infection control practices in the facility. Targeting and reducing prevalence of these infections could be achieved by effective data collection on the infection types, identification of affected patients, and providing staff with evidence-based infection control practices, providing them with financial resources and training that is needed to reduce such infections. I will hold discussions with the infection control coordinator of the facility on infection management processes and practices and their enforcement. I will also conduct interviews with the facility physicians, like I said earlier, and practitioners, as well as other members of the IDT team. Practices to reduce prevalence of healthcare infections will be discussed in details with the facility physicians, practitioners, and the entire interdisciplinary team. Contemporary research studies and literatures on earthquake-acquired infections will also be reviewed for evidence-based infection control practice and guidelines. The field work is of significant importance to me personally because, as a director of nursing in a nursing home and rehab in a nursing home for over 10 years, I have seen the devastating impact of healthcare-acquired infections on the health and recovery of patient population. I have also noticed through the course of the years that healthcare facilities are becoming a dangerous and stressful place for patients. Not just the patients, also for family members and even the staff that are taking care of them. Also, the financial and economic burden of the infections are exorbitant and cannot be overemphasized. Therefore, with effective implementation and enforcement of evidence-based infection control practices, both the health and financial burden of these devastating infections could be alleviated. Although I'm currently employed at the facility and work 32 hours per week, in order to be able to devote enough time and resources to the field work, I intend to devote 2 hours outside my daily scheduled hours for a total of 8 hours per week to this study. During this period, I will be reviewing medical records, collecting data, conducting interviews relevant to the study with the patient, physicians, and other members of the team. Also, in order to complete a comprehensive, meaningful study, I intend to start the fieldwork during the week of January 2018, during the first week of January 2018, and complete the study by the end of February 2018 for a total of 8 weeks. During the course of this fieldwork, stakeholders and infection control champions will be identified and engaged to assist with the study program study program rollout and its expansion. The stakeholders will be the ones that are actively involved and influential among their peers in the care development, management, and care for the patients. The stakeholders range from nursing home administrators, infection control coordinator, unit managers, physicians, nurse practitioner nurses, nursing assistant dietitians, and housekeepers. Feedback from these stakeholders will be potentially helpful in identifying gaps and opportunities for practice improvement.